Good morning and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing very well today. My name is Katie Berg and I am a research study coordinator here at the Havey Institute. I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm very good. How are you?
Very well, thank you. Those who are returning will remember Dr. Robert Murphy as the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases, here at Northwestern University's Feinberg School of Medicine. He answers your COVID questions, infectious disease questions, and public health questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions as well as addressing the latest headlines regarding to public health, COVID, etc. through today, June 8th. We invite you to submit any questions you have below on our YouTube, via our Facebook page at NU Institute for Global Health, or by email at globalhealthinstitute@northwestern.edu. We're going to start with some updated COVID statistics for the United States. First, we're averaging around 10,300 COVID cases per day, though because we're no longer getting national reports from labs, it is hard to verify that number. The average new hospitalizations per day is 1,109. The average COVID deaths per day is 97, and we're still sitting tight at 17% for new booster proportion. Dr. Murphy, can you give us some reactions to those numbers and trends?
Yeah, no, the trend is all going in the right direction. And this is the first time we've been below 100 deaths per day since early on in the pandemic. I don't know if you remember back in the early days, certain people were predicting, oh, we're going to have 10,000 deaths. That's it. And we can all go back to being, our normal selves. We had almost 1.2 million deaths. So that prediction was off by over 100. And we're finally down to this low level, an endemic level. So this is great. And, the question is, do we stay here? Does it just keep going down? With the flu, it wobbles between around 100 deaths per day on average for the year. And remember, flu is only in 6 months of the year. So it's like 200, but then 6 months, it's almost nothing. So so it's a really great sign. So we don't know what's going to happen. But it's not gone. And is this just going to be like the flu forever? We don't know. Nobody knows. So we're going to find out. It's going to be interesting population experiment. I doubt very much it's going to go away, but let's see where the bottom is on this.
Yeah. And because we're not getting those laboratory COVID numbers reported, how are, experts at the CDC and in infectious disease kind of keeping track of those COVID case numbers? Where do they look?
Well, the numbers are just one estimate. This is an underestimate. And with the flu probably also, because a lot of people don't get properly diagnosed and they get treated or they had the flu or whatever. It's the same thing, but it's a hard number. It's been estimated that, because people can go buy the test in the pharmacy and get tested and nobody knows what the results are. That's been around for since we started having the over-the-counter testing. So these numbers typically need to be multiplied by some factor. We don't even know what the factor is, somewhere between 2 and 10. So it's more. We don't know how much more. It doesn't make any difference because the metric it's going to go no matter which way you count, up or down. So we're interested more in the trajectory of the numbers than the actual number. We know the actual number is higher.
Yeah. And are there any places in the US, maybe any cities that are predicted to have any clusters of outbreaks or that have been having them?
Well, that and globally too. The same thing has happened globally. It's down everywhere, but there are upticks in the Western Pacific and Southeast Asia in a few spots. And in the United States, we did have a couple upticks in some counties. And another way to look at this is from another study that was reported here in New York City, which is doing surveillance of wastewater in 14 different wastewater plants in New York City. And they're finding that the amount of virus in that water is up in all 14. I think 3 of them was minimally elevated or slightly decreased, but overall, they're seeing an increase there. Now, that hasn't translated into more cases yet, but it could be that there's going to be an uptick there, that will be recognized. So it's just a surveillance plan. There are many of these surveillance plans in cities across the country. And it's just another way, if all of a sudden you see big spikes in this in one city or another, public health people can be prepared to deal with it.
Absolutely. So we're going to move on to our viewer submitted question for this week. We had a great question. Thank you for sending it in. They were looking at some research regarding incident diabetes following a COVID-19 infection in both adults and children. Can you break down any of these findings that were published?
Yeah, well, we've known from the beginning that diabetes is one of the risk factors for serious disease. That's been very early on. Any kind of cardiac disease, any kind of diabetes type disease, any kind of underlying active cancer, that's been known. So these are some big studies. The adult one is 629,000 plus people from British Columbia, and the pediatric one is over 1 million children over the last few years that have been followed. And they found that COVID was, if they had COVID, there was an association with more COVID and diabetes. There was a link. It's not like super dramatic, but it is a statistically significant increase. Now, the question is, what causes what? It could be that diabetics, because of their risk for disease, get diagnosed more because they get easier to get sick and they get sicker and they end up being reported. So that's called a predisposition. So we still don't know the cart or the horse, what's going on here. But it is associated with more COVID. Diabetes is associated with more COVID.
That's very interesting, and certainly we'll be looking out for any more research that comes out to keep you updated on that. Moving on to some of our other COVID-related highlights and headlines. There was a report that we have very high levels of immunity to SARS-CoV in our bloods now. Can you explain to us what that means and what that looks like for our future?
Right. So everybody's heard about antibodies to SARS-CoV-2, the virus that causes COVID. And this is what you're referring to here is looking at blood banks. So, people going in to donate blood. So they're otherwise healthy people that are donating blood. And they check everybody for, a variety of diseases before they give that blood to somebody. They check it for HIV and hepatitis and all sorts of other stuff. And so they just threw in the antibody test for COVID to see what's going on. So they looked at over 72,000 people, all these blood donors, and 96% have antibody to COVID, to SARS-CoV-2, the virus that causes COVID. That's enormous. And that's why our numbers are going down, because there's so much immunity out there. Then they break the antibodies down to those with just spike protein, which is the antibody to spike protein is what you get with the vaccine, versus other antibodies like the nucleocapsid protein, which you get if you get the disease. Those are called hybrid people if they have both of them, or they have the nucleocapsid protein in particular. And we've known about that for a while. And we know that the hybrid patients typically do better. They have higher levels of antibody and they get less sick. So if you've had the vaccine and you had COVID, you're actually better than having 2 vaccines. And, that's the way it works out. And that's the same thing that they showed here, that the hybrid patients, donors anyway, they weren't patients, they're donors, the hybrid donors have higher levels of antibody. So, it just all pans out. But the big take home point is that, especially now, with the cases dropping like they are and the endemic nature of the disease versus pandemic, that this is associated with 96% antibody production. Now, they've done these blood studies already in 2020 and 2021. And the proportion of people with antibody was much lower, like in the 60%, depending on where we were in the pandemic stage. So I think the real take-home point is that in a highly contagious, potentially lethal disease like COVID, you've got to have over 90% antibodies in the community to tampen the whole thing down. And this was predicted a long time ago, and it's very similar to measles. Measles is highly contagious. There's a question, which is more contagious, measles or COVID? They're both super contagious. And it tells us that if you're not over 90% immune, in other words, the presence of these antibodies, you're not going to control the disease. And we know that from outbreaks of measles in California, when it drops below 90%, they have outbreaks again. They have clinical outbreaks. So, these two diseases, these highly contagious diseases, you have to have a lot of immunity in the community to control the infection. So it just verifies what we had suspected at the beginning, and the prediction is true. You've got to have more than 90% to control this thing. And now that we have more than 90%, we're okay. But remember, still almost 1.2 million people have died from this.
Absolutely. It's really a model of herd immunity in action of how we've been able to get to this point. We have had sustained interest into the COVID antiviral drugs, Paxlovid and others. There has been some more data that just came out kind of comparing different COVID antivirals. Could you let us know what the researchers found?
Well, these are called small molecule antiviral drugs. So Paxlovid is more commonly used, but molnupiravir is also used. And the two of those are approved, or at least they have EUA approval. And the study in 27,500 people looked at any kind of antiviral therapy. You could have either one. It wasn't comparing the two. That's a different kind of study. But just if you had antiviral therapy, like you take Tamiflu for flu, if you take any of these two drugs, does it work? And they found there was, if you take any one of those, you have a 77% chance or decrease in the death rate. And so these drugs are only used in high-risk people. So, high-risk people are at risk for death, hospitalization and death. There were some signs that maybe Paxlovid worked better, but we've already suspected that. But any antiviral is better than no antiviral. And that just makes biologic sense. And it doesn't matter if you had the vaccine or not. So if you didn't take the vaccine or you didn't finish all your vaccinations or whatever, it does not make any difference. Even if you finished all your vaccines, it benefits you. Because what's happening now is that the people really, it's just because there's so much immunity, the people at most risk now are those over 85 years of age. Really fragile, elderly people with underlying diseases, many of them. And so, Paxlovid and molnupiravir work. And so if you do get sick, you're in a high-risk group, you have some underlying disease that puts you at high risk. Even if you're a child, you should take one of those drugs.
Well, thank you for that clarification on the study. And also, it's just really, really great to hear and to continue to get research showing that these drugs are helping the people who need it most.
They're life-saving.
Yeah, amazing, amazing antiviral drugs. So moving on to our final story, we've gotten a lot of questions throughout the pandemic about how COVID itself and how the COVID-19 vaccinations may affect fertility in women. There's been some more studies that came out regarding this subject throughout the pandemic. Could you let us know about any new research that's come out?
Yeah, so there have been some very large studies that have shown that the vaccine is safe in pregnancy. And matter of fact, there's better outcomes if you have the vaccine in pregnancy, because you get less sick and the kids do better and kids get antibodies. And this most recent study from Baltimore again showed the same thing, and that the fertility rates in people who had the vaccine were absolutely no different from people that did not have the vaccine. So it's just yet another study that confirms what we already knew, but now we're continuing to study all the data, as now there's a massive amount of data. Now it's all putting it together and making some sense out of it. And just to show that these vaccines were safe and did not impact fertility in women.
Absolutely. And that's a great message to just keep getting out there, just in case people haven't heard it. These vaccines are safe for you and potentially your unborn child.
And you can
So
even take it. Pregnant women can even take it. There's studies with thousands of pregnant women who took it. And they do better than if they're unvaccinated, because getting the disease while you're pregnant is much worse.
absolutely. Absolutely. Well, thank you so much, Dr. Murphy, for your time and expertise, sharing your opinions and facts about these headlines and questions. It's very much appreciated. And thank you so much to all of our viewers who continue to come back and watch this segment. We really appreciate it and hope you have a great day.
Great. Thanks, Katie.
Thank you.